Imagine having major lung and heart issues and having no idea why. Hi, I'm Dr. Zach, a physician. Let's talk about this medical mystery. And your doctors have no idea why, because nothing runs in your family. There's no problems as far as your medical history goes. And suddenly, boom, you're having blood clots in your lungs, you're having blood clots in your heart. And the doctors get together and they can't figure it out because you tell them no one in your family's ever had any problems. That's the issue she had. And it all came down when she took a 23andMe. And it was obvious she actually had multiple genetic conditions. The reason why no one in her family had those genetic conditions was because she was a child of artificial insemination. Artificial insemination is essentially when they take a sperm donor's product and they insert it into the uterus. This patient's sperm donor was over 60 years old. It turns out this patient's sperm donor was also the sperm donor to many other children, and this patient's sperm donor was also the physician administering the artificial insemination. Dr. Charles Pete Jr. was that physician who was assisting people with infertility, and he would tell patients that it would probably be a medical residence sperm product from the hospital, which was actually a kind of standard thing to do back then. However, he ended up using his own sperm without informing the patient or consenting the patient that he was going to do that. He actually had no documented medical issues or issues with Marfan syndrome, which is what the patient ended up being diagnosed with. But it's possible that as he was getting older and donating these sperm products, you had what was called a de novo mutation, or like an original mutation that caused these issues. This article also documented the first artificial insemination that was done in 1884. It's kind of fascinating. The woman come in, they deemed that the husband was sterile. A medical student joked, "You need a hired man to get this woman pregnant." Kind of an inappropriate joke, of course, but then they had the idea from that joke to administer chloroform to the woman and obtain a semen sample from one of the medical students, and then they plugged the uterus with gauze, and lo and behold, she became pregnant, and there you go. But they were sworn to absolute secrecy about this. I guess if you're having unexplained medical conditions that may be attributed to genetics, but you have no one in your family with that, I don't know, get a 23andMe or something. It might help. If you're in fertility medicine, don't do that. That's crazy.